Okay, so today we're going to talk about how to use an incentive spirometer for lung volume expansion. And so that is going to be a really good option for patients that are post-op and to prevent atelectasis. And so to use an incentive spirometer, you first are going to check your doctor's orders to make sure that it's ordered for your patient, and then you're going to knock and introduce yourself and your department, and then you're going to explain to your patient what you're going to do. So to do incentive spirometry, this is the device that we use, and the goal is based on the patient's gender, height, and age. And so each device comes with a little instruction manual on how to set goals. So if we have a female patient who is 80 years old and she's 60 inches tall, her goal would be 1,500. And so we use this little device here on the side to set the goal. And then what you're going to do is instruct your patient to exhale completely, and then they're going to tightly wrap their lips around the mouthpiece, and they're going to slowly and deeply inhale for as long as they can, and then they're going to do a breath hold for about 3 to 5 seconds, which is the most important part of incentive spirometry, because that breath hold is going to allow the alveoli to pop back open, and that's the whole purpose of incentive spirometry, is to prevent atelectasis. And by popping open those alveoli, that's how we're going to do that. So as they take that breath in, this little white float is going to rise, and then there's a float on this side. And we want this one to be between better and best, and we hope that the white float will get close to the goal. And over time, we can just work toward that goal. So it's important with incentive spirometry that your patient's at least getting a third of the predicted normal. And also with this, this patient's going to do this about 10 times per hour. And you really want to be good about coaching your patient, because you don't want them to breathe too quickly because they could hyperventilate. And you really want to make sure that they understand how important that breath hold is. So after the patient has done their treatment, you're going to have them take a deep breath in and cough, and that's going to help mobilize secretions and just aid in the whole lung expansion, lung volume expansion process. And then what you're going to do is do another assessment. So you assess the patient when you came in, you're going to assess the patient now. So you need vitals, you need breath sounds, you need to do that full assessment of your patient to make sure that this is actually working for them. And then you want to make sure if they have any questions that you can answer them. And then you're going to periodically check up on your patient and make sure that they are still doing their IS treatments and continue those assessments.